Nurse.org and Major League Sports teams are honoring nurses with discounted game tickets and once-in-a-lifetime experiences. From throwing the first pitch to riding the Zamboni to on-court recognition, join the fun. Visit nurse.org/nurse night to find a nurse appreciation event near you and grab your discounted tickets today. You're listening to Nurse Converse, presented by Nurse.org, a collaborative podcast amplifying diverse nurse voices. Get ready for a dose of inspiration, a sprinkle of education, and a whole lot of community.
Welcome back. I'm Advocate Maggie. I am the CEO and founder of Advocates for Nurses. You've heard me talk about nursing innovation, now all the way to whistleblower, what that means. I'm going to break some of this down. I wrote an article on the platform, so make sure that you get on over there. Check that out. I write these articles, whistleblowing and nursing, know your duties and protections, and other articles like that on the Nurse.org platform because it helps to educate my people and why I'm called to this space. A few things and go over some basics about, what's the big deal with whistleblowing? Well, it is, folks. The next 30 minutes, I'm going to pull in some of the rules, the regulations, go over basic definition, some basic things that you can do to protect yourself and why it is a big deal. We're going to talk about duty, and always actionable items, comments. Please make sure to like, follow, and want to hear from you. Again, I'm Advocate Maggie. I've been a nurse for, oh my gosh, this year, 25 years. I've worked in many different settings, most notably, and people know me, and part of the reason why I'm here and created my niche is that I did spend a short period of time at a board of nursing, and boy, folks, let me tell you, when that did change my life. It made me realize that the rules and regulations that dictate our professional license are a big, huge deal. So when I read from books, and I know I'm going to hold it up here, some of you are listening and some of you are viewing, but I'm referencing the bound rules and regulations that dictate our professional license to include some whistleblower regulations and why I think it's important to touch on this. It is a big deal because we have a duty that binds us to protect the patient. And when that duty or that relationship is created with that patient, some of the things that could happen to us could also protect us under what is also like whistleblower protections. So let's just start there. Let's start with the basics. What is whistleblowing? And what are some regulations? Whistleblowing is the act of, uncovering any kind of act, service that's happening, and it could put the organization, the patient at risk. So what are some of what would be an example of that? There's fraudulent documentation happening, fraud, waste, and abuse, and you don't say anything. There is a patient that's not being turned, that's being grossly neglected because of staffing, and you don't do anything. They develop pressure sores, ulcers, and they develop unstageable pressure ulcers, develop sepsis, go into renal failure, go into multi-system organ failure, and have a bad outcome. And you didn't say anything, or you did say something, and now all of a sudden you are the stellar employee. Then you have 15 complaints and write-ups against you. And you're like, wait a second here, pump the brakes here, folks. I reported this entity. I used my chain of command. I followed the rules and regulations, the laws that are designated to protect workers like myself who report misconduct, unsafe practices, illegal activities. These regulations, are they not to ensure that I get protected as well? And the answer is yes. That's why it's really important, and that's why I created Advocates for Nurses and Advocate Maggie, because once you know some of these protections, and I'm going to read to you from my own state, and I encourage you to go to your own state board of nursing or the entity that's given you the rules and regulations to practice, because that's just one place that holds whistleblower rules and regulations that dictate your professional license. And so I don't want you to panic. I know I'm saying a lot. I want you to take a deep breath, because there are protections for you, even though you do have a duty, and then you need to lawyer up. You got to lawyer up, and you're going to take the rules and regulations from your state board of nursing or the entity that's given you the privilege to practice, along with policy, state, federal, whistleblower protections. Let's just say if you get reported to a board of nursing, let's go back to that, pivot off of what I was just talking about. All of a sudden, you have all these complaints and you're standing in front of one of these 4-letter agencies trying to defend of what you did or did not do. You need to understand that there are whistleblower protections that could protect you possibly under the rules and regulations in your state. So under your state, federal, and then under the board of nursing. And I'm just going to read to you, just because, again, I know it gets a little bit confusing. I have the bound form that I'm going to read you from Texas. I was a prior investigator for a board of nursing, and this was something that was given to me. It's not unique to me. Anyone can have this. Your state board of nursing may have already bound that you would have to pay for. Oftentimes, your state nurses association or your student nurses association during the conference will sell it. They bind it, they get to make a couple dollars, and it's something very useful to nurses. I do believe I saw it at the last Nurses Association conference here in my own state of Texas. They had it bound and they were selling it. And I think it was by I think it was maybe even the Student Nurses Association. So make sure that you hit both of those up and see if they have those. So I'm just going to read to you because we're talking about whistleblower protections. And I'm going to go to 217.20, and then that'll be under 17. And I'm just going to read to you from there. And so this section is safe harbor, peer review, and whistleblower protections. Now, not every state is going to have safe harbor or peer review. Texas does. Now, whole nother episode, every state can have safe harbor. Every state can have peer assistance. Your nurses association, the nurses all have to advocate for it, got it passed, but there's a process, and I don't want to speak out of turn, but they got it passed. So check that out. You can get that stuff passed as well in your own state, but I digress. That falls under that section C20. So 217 C17, whistleblower protections available to a nurse that prohibit retaliatory action by an employer or entity because the nurse A made a good faith request for safe harbor nursing peer under TOC, Texas Occupational Code 303.005C, in this section, or B, refused to engage in an act or omission relating to patient care that would constitute a violation of the NPA or board rules as permitted by TOC, NPA, and nurse invoking safe harbor under this section must comply with the subsection D, G of this section if the nurse refuses to engage in the conduct or assignment. So some of that's not applicable, but goes on to say, C, made a lawful report of unsafe practices or unsafe patient care practices or conditions in accordance with TOC 301-4025, report of unsafe conditions of non-nurse entities, and 217-19J2 of this title. Wow, that's a lot. So I say all this to say you should know what the rules and regulations are that say there. Get legal counsel. Make sure you check out your state rules and regulations, different than your board's rules and regulations, as well as federal, when you're looking at anything related to whistleblower. And when we talk about lawyers, let's just pause here for just a minute. And just like a nurse is not a nurse, a lawyer is not a lawyer, it's not a lawyer, making sure that you do seek out the correct legal counsel depending on, let's just say this, you filed a complaint, let's say it's a class action complaint, you file something to OSHA, and all of a sudden now you get reported to a board of nursing. But you're working with an attorney because you have an issue related to, let's just say, wrongful termination, workplace stuff, as well as now you have a letter from a board of nursing. And I know I went down a couple rabbit holes, but those are things that happen as it pertains to some people who, get involved with whistleblower stuff. So it'd be remiss for me not to talk about that. You have to make sure that you have the right lawyer. A lawyer who represents nurses or healthcare providers in front of an entity is a professional licensing attorney. You need to make sure that you reference them if you get a complaint from an entity. You should also make sure that you have the right attorney if you're involved in any kind of workplace issues. Those are very different issues. If the workplace issue crosses over to the board of nursing, or if it's just a workplace issue and it's not even yet reached over to the board of nursing, I would 100% be asking that lawyer to reach out to professional liability attorney, one of their peers, and just say, hey, can I ask you some questions? Because I have a nurse and this is the type of law I practice, but her and I are both fearful, or him and I are both fearful that this could go to a board of nursing. So I just want to make sure that as we're moving along this whistleblower case or wrongful termination or whatever it is that you're involved in, I'm handling this correctly, because if it does go to a board of nursing and we've written XYZ down or we've said this, could this come back to bite a nurse in the butt? So those are things why you want to make sure that you get the appropriate lawyer. Again, a nurse, not a nurse, not a nurse, just like a lawyer is not a lawyer, is not a lawyer. Making sure you know that having professional liability insurance as well. If you are under investigation by a board of nursing, we're going to go down this rabbit hole for a second. Another article on Nurse.org that I had the opportunity of doing. So I should hope that you get over and check that out. Get on over to the website. Talked about this on some of their Instagram lives as well. Talk about this on my own platform. We're going to go down this rabbit hole for just a minute, because let's just say that you are involved and that you report something. You're the whistleblower. It's you. Now you're involved, and let's just take it down one of these rabbit holes that we talked about in other forms of litigation. You're spending lots of money on this wrongful termination lawyer that your professional liability insurance doesn't cover. But now you're involved in a board of nursing case. You got limited funds. You know what your professional liability is going to afford you? A board of nursing attorney. You got to get professional liability insurance. You don't think you need it, and then it's too late. You are financially exhausted, and I've seen nurses. I've seen this as a reality for nurses. They're going through insert any other type of litigation, because I talk about this on my other platforms. I talk about this in my Intro to Legal Nursing course. When you are a nurse, you practice under 3 types of law: civil, criminal, administrative. And that's just the basics. I'm not going to get into other nuances. Now you're standing in front of one of these courts of law. It can be financially exhausting, go on for years. Now standing in front of a board of nursing, having the professional liability insurance affords you, at least if it's civil litigation, if it's board of nursing litigation, 2 types of lawyers. It's kind of like having your deductible. You have home insurance, car insurance, medical insurance. Something happens, you need a procedure, you're looking at the list. Who's the doctor? Who's the mechanic? Is covered under my policy? You reach out to them. It's the same situation with your professional liability insurance. You get a list of administrative lawyers, civil lawyers, if you're involved in that type of litigation, all due to possibly, you whistleblowing, you uncovering something. It's costing the organization a lot of money, a lot of time, pain, and they're trying to throw you under the bus. And now you're involved in many different types of countersuit suits, all the words, because you did your duty. And it is absolutely your duty.
Hey nurses, looking for exclusive discounts? Nurse.org has you covered with deals on everything. Save big on the essentials you need to excel in your career. Don't miss out. Visit nurse.org/discounts for the latest discounts made just for you.
It is your duty to report these things. You have a duty to the patient that supersedes a hospital policy or a physician order, and that's from 1983 in my own state. Now, your state may not say that specifically, but you are bound to the patient. When you develop a relationship with them, you then have a duty. Therefore, you're not allowed to look away. We're not allowed to look away. If there's behavior that's negligent, that's abusive, that would need to be reported, and we do nothing, then we too can be reported, and it can't be after the fact. The whistleblower protections and rules don't protect you if 2 years from now, it happens 2 years ago. Now there's all of a sudden there's a case, and now you're like, oh wait. So about that. So I know that was 2 years ago, and I had a duty at the time to report that, but I didn't. But now I'm speaking up. That's going to look real suspect, and that gets real hard to defend. So you do have a duty to stand up, to speak up, to stop the lying. These are all things that we talk about. You absolutely have to do that. And If you don't do that, your insurance may not even cover you. If it's gross negligence, then in the fine print, you should check on page 554, and I'm being facetious, of your policy. But if it rises to the level of any kind of gross negligence, your insurance may not cover you. So you have to stand up. You have to speak up. It's important that you know that the rules and regulations as it pertains to the whistleblower protections, because you do have, as I talk about in the article, so make sure you get on over to Nurse.org. When I talk about, the definition of whistleblowing, but you have a duty, folks. You have a duty. You have a duty to protect the patients. You have a duty because you have a professional license. When you got handed that professional license, and I'm not here to tell you I knew that in full depth when I first got a license. No, I did not, folks. It was not until I was within agency that stuff really comes to fruition. And I realize that the rules and regulations that I'm holding up the book are no joke. 217 20 is just one section that I read from there. 3 sections that I'm going to give you a gift that you should know outside of where the whistleblowing protections rules are under your state. You also want to look at grounds for discipline, unprofessional conduct, and standards of practice. Because anything related to whistleblowing or your duty will also be tied into some of that stuff as well. That you do have a duty, and so it will come to a clearer picture what your actual duty and responsibility is. And what do I say, folks? What do I say to my nurses? Knowledge is power. So make sure that you get on over there. You understand those 3 sections: standards of practice, unprofessional conduct, and grounds for discipline. Most important sections that you can know. Everything else in that book, honestly, why do you care how a school gets, assessed? Or that's not, you don't do that if you're not an instructor. Why do you care? The 3 sections are the ones that I referenced, as well as going to the whistleblower protections under the rules and regulations as well. That's just really, really important, because I'm going to talk a little bit about, civil litigation, duty, breach of duty, causation, and damages. Those are all things in civil court. Those are the 4 elements. So how did you have a duty? You developed a relationship with them. What does that relationship come from? You're a nurse. If you didn't have your badge on, you wouldn't have a nurse-patient relationship. Therefore, your duty to that person wouldn't be the same, nor possibly even exist, because you do have a duty to the patient. That's what ropes you in to being a whistleblower, having a duty to report. These are things that you have to really think about when you become a nurse. If you're working in environments where it's not safe, you're doing things, you're seeing things, you have to report, you have to document, you have to report internally. That could be using, a Midas, or whatever incident report using system within your agency. You have to do that. You're taking it up the chain of command and it's going nowhere. You still have a duty to report that. If the conduct is still happening, there are agencies outside of that organization that you have to report to as well. I know it seems like a lot and it doesn't seem fair. We always get told as a nurse, I know, what did you do? But what you do, that's not fair. I do realize that, but some of that stems from, we do have a duty. The rules and regulations dictate that you're going to have a policy within your organization. So I tell nurses, let's empower one another. Let's empower yourself. So as we start to wind it up, and I went over like your duty, your responsibility, let's talk about some things that you can do in your own environment. Yes, you have a duty, moral, ethical, by law. You're going to report within your agency. And those are all things that you're going to do. But also, don't stay at a place that's not supporting you. If they're doing grossly negligent things, they're not supporting even the patients in the environment. They're not creating a safe space. They're being abusive. Whatever it is that you deem is questionable, and now you're even questioning whether this is, a whistleblower situation, then leave. Give your notice, file your complaints, and leave. Don't stay at a place that's not supporting you. Those kind of things lawyers talk about all the time. It's not a matter if, it's a matter of when that you could possibly be standing in front of one of these 4-letter agencies that promise you don't want to stand in front of. I've been doing this for almost a decade now, And it breaks my heart every time I see a nurse stand there. Protect yourself, protect your patients, prevent yourself from being involved in any type of this possible fraudulent, let's just say, documentation, altering documentation, billing practices, manager falsifies documentation or ask you to alter documentation. You can't do it. You have to stand up, you have to speak up, you have to follow the policy, you have to maintain ethical standards. Get yourself a manila folder, what I like to call your portfolio, and start slapping stuff in there. What does that look like? The policy, the rules, the regulations, maybe some legal cases, and then it's not you. You're like, ooh, hey, manager Sally, it says right here that I can't do XYZ. Says right here under XYZ, I can't do that. And if I do that, this is what's going to have to happen. And it says here I have to report to these agencies, even within the policy. Oh my gosh, like I wouldn't want to violate that policy. Know those types of things. Leverage that. Get your manila folder. It's not about you, it's about them. And because if you neglect to do that stuff, you can become complicit in perpetuating the problem, and you can be found accountable, put under scrutiny, because nurses don't get just to stand by and just watch conduct happen. Please believe me when I say that it is your duty to report. Unfortunately, I was a prior investigator for board of nursing. I see nurses almost daily get asked again, what did you do? Did you report it? Did you follow the policy? And there it is. Didn't even follow the policy. They have your employee file, and now you're hijacked because you didn't follow even the policy within the organization. So as a nurse, you have to uphold the rules, the regulations, using your chain of command, even if you're a nurse leader, even more so if you're a nurse leader, you're a manager, even charge nurse. If you choose to be in the charge nurse role, that job description can and will be leveraged against you. If you're a nurse manager, you're a nurse director, these all speak to the responsibility and your accountability as a nurse leader, administrator, and you supervise other professionals and you're involved in any kind of wrongdoing, you absolutely have a duty to report, to intervene. This is a big deal. Administrators, even if you're a nursing administrator, big, huge deal. Be sure to subscribe on whatever platform that you're listening it on. Whether you're on Spotify, you're actually on the website, be sure to subscribe and check out the articles that I've written. Not only this one, the Whistleblower, but I've also written several other articles. I'm be super honored for you to check out as well, talking about malpractice. If you get a board of nursing complaint, Radonna and I are doing some podcasts as well, talking about her recent case, being in front of the board of nursing as it pertains to administrative laws, setting some precedent as it pertains to some rules and regulations that haven't been set as it pertains to just the investigative process. I got way long-winded there. That can be confusing, but get on over. Check us out. We're going to break down some of this stuff, talking about things that I feel are near and dear and sometimes not well understood. Whistleblowing, being one of those. It's vital to maintaining what I feel is like the integrity of the nursing profession. We're ensuring patient safety on our environments, which makes it safety for us. We're protecting our professional license. It can be difficult, I understand, but the responsibility is absolutely, unfortunately, non-negotiable. The rules, regulations, holding up the book again, dictate that state law. We have to adhere to state law, federal law, all again, holding up the book, says in the book. It's absolutely our responsibility. Spell some of that stuff out in more depth in the article on the website. So I hope that helps. Like, follow, and share. Stay safe out there, nurses. Drop your comments. I want to know what's happening out there. If you've been a whistleblower, you know what the law is in your state, some things that you did that work, that you didn't work, some things that you suggest. Please drop that all in here so we can help, because we're all here as nurses and myself as a co-contributor to help you better understand your environment so that you have tools in your environment to help you understand how to protect yourself. That's why I'm here. Advocate Maggie, trying to teach you the rules, the regulations, how you can protect your license. And one of those is through whistleblowing. So I hope the article was beneficial to you. Be sure to get on to Nurse.org, that you get over to Instagram, TikTok, all these social media platforms. Give them a follow. Give me a follow. Advocate Maggie, Advocates for Nurses. Stay safe out there.
Thanks for joining Nurse Converse, brought to you by Nurse.org. Help us grow by leaving a 5-star rating and review on your favorite podcast platform. Nurse.org supports nurses with career and education tips, life advice, and breaking news. Thank you for all you do and for being you.